Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about being worried, nervous or anxious, and specifically people who experience this sometimes debilitating condition. Often, these people are assessed by a doctor or mental health practitioner and diagnosed with anxiety. With me today, I have Dr. Lynette Hillsberg, who will explain what this means. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
So, tell me briefly, what is anxiety?
Well, anxiety is the overall condition that is diagnosed, but there are different elements and presentations with this. Basically, there are 5 elements. There's general anxiety disorder, or GAD, obsessive compulsive disorder, or OCD. There's panic disorder. There's post-traumatic stress disorder, or PTSD. And social phobia or anxiety disorder, or SAD.
I've heard of obsessive compulsive disorder. Is that the most common?
Okay, so obsessive compulsive disorder, or OCD, affects around 2% or more than 500,000 people in Australia. And around the world, it's the 4th most common disorder.
So, what happens when someone has OCD?
Well, the person has ongoing intrusive thoughts and fears, and that causes the anxiety. This then leads to extreme behaviours, and some of which are visible while others are not and are mental behaviours.
So, what do you mean by this? Doesn't everyone have behaviour?
Yeah, but the behaviours that the person can't control, and these are called obsessions and compulsions, which is where you repeat the behaviour over and over again.
Do you have an example of this?
Okay, so the person may be concerned about, say, germs or hygiene and cleanliness. They may check and recheck their work or worry about doors being locked. Taps and gas or other home appliances being turned off before they leave the home. Alarms being set, number counting, or even rearranging things in the house like kitchen furniture or clothes.
Do people know why they do this?
No, not always. There isn't generally a logical connection between obsessions and compulsions. Many people do recognise their behaviour is not rational, yet still feel a need to perform the repetitive behaviours or mental compulsions.
How long does the person do these behaviours for?
Well, they may spend several hours a day focusing on their obsessions, performing seemingly senseless rituals. If left untreated, OCD can become chronic and interfere with a person's normal routine, schoolwork, job, family, or social activities.
And does this just affect adults?
Most adults are aware of their behaviour, but children and teens may not recognise their routines and their behaviours are excessive. And people with OCD are also at risk of developing depression and other anxiety disorders.
What would these be? You mentioned social anxiety before.
Yeah, many people experience anxiety at some point in their life, being anxious when facing a new situation for work, school, shopping, meeting new friends or group activities, even using public transport. Worrying about being late for an appointment. They're quite normal for most people. Sometimes people are so distressed about engaging in social situations that it interferes with their daily life. They believe they may be scrutinised or act in a way that's embarrassing or humiliating, and the social situations cause a great deal of anxiety.
How does someone recognise this?
The person usually recognises the anxiety level as excessive or out of proportion to the situation. This is because they have unwanted fears or thought patterns. They experience real physical symptoms like a heart pounding or heart racing, shortness of breath, lump in the throat, shakiness, feeling chills, flushing, tingling feelings or sweating. They have some kind of compulsive behaviours.
So, what about other types of anxiety disorders?
Yeah, there is general anxiety disorder. That's where the person feels anxious on most days, worrying about lots of different things that last for more than 6 hours. The panic disorder is where the person has panic attacks. These are intense, overwhelming and often uncontrollable, with feelings of anxiety combined with a range of physical symptoms.
That sounds awful.
Yeah, it is. Someone having a panic attack can experience shortness of breath, chest pain, dizziness, excessive sweating, and sometimes they think they're having a heart attack or about to die. If the person has recurrent panic attacks or fears they're more than a month, then they're said to have the panic disorder.
And what about post-traumatic stress disorder, PTSD?
Well, PTSD can happen after a person experiences a traumatic event like war, assault, accident or some sort of disaster. Symptoms include difficulty relaxing, upsetting dreams or flashbacks of the events, as well as avoiding anything related to the event that's actually happened. PTSD is diagnosed when a person has these symptoms for more than a month.
Okay, so what is the treatment and how does someone get help if they feel this is something they have?
Well, the first thing to learn is how to control your anxiety so it doesn't control you. For mild symptoms, you could try some lifestyle changes, such as regular physical exercise to reduce your stress levels. You might also like to try online e-therapies, many which are free, anonymous, and easily accessible for anyone with the internet access. If your symptoms of anxiety are moderate to severe, then it would be helpful to link into psychology or medical treatments. The main one is cognitive behavioural therapy, CBT, which is referred to as talk therapy.
Yes, I've heard of this.
Yeah, CBT is a structured psychological treatment and that recognises the way that we think. It's a cognition, an act, which is our behaviour, and this how affects the way we feel. CBT involves working with a professional therapist to identify thought and behaviour, patterns that are either making you more likely to experience anxiety. Once you've recognised these unhelpful patterns which are contributing to your anxiety, you can make changes to replace these with new ones that reduce anxiety and improve your coping skills.
Okay, so this targets the thoughts, but what about the behaviour that goes with it? How does this change?
Okay, behaviour therapy as part of CBT relies mainly on a treatment called graded exposure. There are a number of different approaches to this, but they're all based on exposing you to specific things that make you anxious. This experience helps you cope with fearful situations rather than avoiding or escaping them, as well as putting your worry about the situation into perspective.
Do you have an example?
So, say I was afraid of flying in a plane. I'd be shown a picture of a plane first, and this is the least difficult for me, as I know the picture and it won't hurt me, so gradually over a number of sessions, this irrational fear of flying will be challenged. I'll talk about why I'm afraid, when did I first know I was scared, that sort of thing. Then as part of therapy, I could lead me to visiting the airport to watch the planes take off and land, or even getting on a plane. If you avoid frightening situations, it can mean you don't get a chance to face your fear and prove to yourself that you can cope with it. In turn, this causes your anxiety to persist.
So this sounds quite difficult to do. What if you can't get to see a counsellor in person because you're so anxious about leaving the house?
Well, as I mentioned before, there are also e-therapies available.
So what are these, and are they easily accessed?
E-therapies are also known as online therapies or computer-aided psychological therapy. They can be just as effective as face-to-face services for people with mild to moderate anxiety. Most e-therapies follow the same principles as CBT, and the structure of these treatments means they're well suited to be delivered online. They teach you how to identify and change your patterns of thinking and your behaviour, maybe preventing you from overcoming your anxiety. This is by working through the program by yourself. E-therapies can be used with or without help from a professional, but most involve some sort of support from a therapist.
So how can we link into these?
This can be done via telephone, email, text or instant messaging, and helps you to successfully apply what you're learning.
How do we access these programs?
The Australian Government's Head to Health website has a library of online programs. Beyond Blue also has a program called New Access, and that's a free confidential service and provides support in the form of a coach. The program includes 6 free sessions tailored to your individual needs and doesn't need doctor's referral or mental health treatment plan, and it's also available on video call or from the phone. You can also speak to your GP and discuss the best options for you, because proper treatment can help you regain control over the illness, feel relief from symptoms and get your life back.
So what are the benefits of this?
Well, online programs have several advantages, including easy to access, can be done from home, can be particularly benefit for people in rural or living in remote areas, can be provided in many cases without actually having to visit your doctor.
Well, thank you, Dr. Linnett, for explaining this important topic and giving links into where we can get support.
You're welcome, James, as always. It's been lovely to chat with you, and I hope this has helped.